Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Orthopedics is a broad branch of medicine that can address everything from simple broken bones to serious diseases of the musculoskeletal system. Medical concerns that affect bones and joints can be very disruptive, especially to children and young adults. During today's show, we will learn more about the most common orthopedic conditions in children, treatment options, and recovery journey. We are pleased to welcome Dr. John Andrew Bowe, Medical Director for Pediatric Orthopedic Surgery at RWJBarnabas Health. Thank you, Dr. Bowe, for joining us here on the show. Can you just tell the studio audience a little bit about yourself, your background, and any special interests that you have?
Well, it's delightful to be here, and thank you for the invitation. I am a New Jersey guy. I grew up in Bergen County. I went to Ridgewood High School. I am a product of public schools, and all of my education has been on the East Coast. I went to the University of Pennsylvania, then I went to Columbia Medical School, then I did some surgical and neurosurgical training at the University of Virginia, and I did all of my orthopedic and pediatric orthopedic training in Boston.
And you are currently the Medical Director for Pediatric Surgery at RWJBarnabas Health, correct?
That is correct.
Now, again, the studio audience, we have kids, children. What are the most common orthopedic conditions that you see?
Well, I'm sure the most common problems that we see are related to trauma and sports injuries in particular. But we also take care of a lot of congenital deformities such as club feet, hip dysplasia, and deformities in the upper and lower extremities. I have a particular interest in spinal deformities from the newborn all the way to the adolescent and beyond. And we see a lot of spinal deformities in our practice.
So we'll start, the baby's born, they go back to their regular primary care doctor a month later, and they see that they've got the hip dysplasia. So what should the parent do at that point?
Well, I think the diagnosis can sometimes be a little nebulous, and I think our pediatricians are very well versed in certain risk factors for children with hip dysplasia. Certainly if there's a family history or if they are born breech. These are situations where the pediatricians are very circumspect about things. And sometimes it's not always an obvious clinical examination. But if they have any suspicion about any instability about the hip or any of these risk factors, then we should probably see them.
So when should the parents bring a child to an orthopedist?
Well, that's a good question because, kids are going to be kids and they're going to be falling and they're going to kind of, bang their knees. And, a lot of times they're nothing serious and parents don't have to be overly concerned. But I think that if there is a significant amount of swelling around a joint, if a child is not using his upper extremity or lower extremity in a normal fashion, if they're not bearing weight on the leg, and certainly if the pediatrician is concerned about something, then I think it certainly warrants a pediatric orthopedic evaluation.
So you just said sports injuries, and of course that is a scary thing as a parent, especially with the kids playing soccer, playing football, playing field hockey even with the hard ball that they are doing, lacrosse, So tell us, what are things that you would do to help prevent sports injuries?
Well, I'm not sure we're going to totally avoid them, but I think certainly adequate training is very essential. And I think that preparing them for a particular sport with pre-sport, stretching, strengthening, and obviously appropriate equipment all make, sense. And, we try to minimize injuries, but I'm sure they're going to happen.
They're always, of course, going to happen, but again, it's important that the child is given the safety equipment, mouth guards, of course. If there's something that they wear a helmet, they wear it appropriately. If they get hit, possibly replacing the helmet, making sure the helmet is still adequate protection. Then you had said also that you talk about the diagnosis of congenital or developmental orthopedic conditions. Can you tell us about that?
Well, I think that any time a child is seen by their pediatrician, there are examinations that they do and we do. I think sometimes when you see a congenital deformity, it's fairly obvious whether they have a foot deformity or a deformity of their upper extremity. I think sometimes developmental problems can be a little more elusive. Children go through certain developmental stages, when they start sitting, when they start crawling, when they start to stand. And I think if they are significantly delayed beyond these normal milestones, then I think it warrants a developmental evaluation. I do think that, we as pediatric orthopedists are sometimes in the first line of physicians to see these children, but it usually requires evaluation by sometimes geneticists, sometimes by developmental neurologists as well.
Now, tell us about the new state-of-the-art low-dose EOS X-ray imaging. How does this help diagnose and evaluate our pediatric patients? And just even explain what a low-dose EOS X-ray machine is.
Well, this has been something that I've been on the soapbox for quite some time. X-rays have been around since the middle of the 1890s by a guy named Röntgen. And obviously, X-rays have been invaluable in diagnosing injuries to bone and joint. But I think, especially in recent years, not only in our medical literature, but certainly in the lay literature, there's been real concern about the amount of radiation, especially in a growing skeleton. And so I think anything that we can do to minimize that amount of radiation is essential in taking care of kids. In particular, there's certain conditions that we take care of, especially scoliosis, which require an X-ray or radiation to a fairly large part of the body. Now, this EOS is a new technology. It's a new type of an X-ray machine that actually reduces the amount of radiation by about 80%. There have been recent studies that have shown that comparing this to standard X-rays, that over the course of a lifetime, it may decrease the likelihood of a child developing a cancer by 5 to 6-fold. So I think that anything that we can do to minimize any further potential risk to a child is up to us to do this. The EOS should probably be the gold standard for X-raying children, not only for scoliosis, but other X-rays as well. In addition, this EOS machine not only reduces radiation, but it actually makes the images clearer and makes our diagnosis a little bit easier. So it's a wonderful machine. I am so excited that we now have this in our new facility.
And where is that facility?
We're still in East Brunswick, not too far from our office where we were for 35 years. It's on Route 18, 645 Route 18.
Thank you. And as an orthopedist, what conditions do you think we should be treating with physical therapy versus surgical treatment?
Well, that's an interesting question. I would tell you that most conditions can certainly be treated conservatively. It doesn't mean that they're not being treated, but I think most musculoskeletal conditions just require some initial rest, maybe some anti-inflammatory medications, but I think physical therapy is an integral part of any orthopedic practice and any orthopedic injury, because what we're trying to do is we're trying to mobilize the joint. We're trying to strengthen the muscles around that joint and hopefully get that child back to a normal kind of, functioning level, no matter what they're doing. I think when you have an orthopedic injury, there's always a little period of rest, sometimes immobilization with a cast or a brace. And during that period of immobilization, there's always a little atrophy, which means a little wasting or deconditioning of the muscles and a little stiffness of the joints. And before we let kids go back to normal activities, especially sporting events, we want to make sure that that bone or joint is healed by the rest. But very, very important, we want to make sure that the surrounding joints have adequate range of motion, and it should be back to normal range of motion and back to normal strength. And that's where physical therapy is crucial.
Same as in adults when we have a condition, and you do rest it, those muscles are going to lose some of their tensile strength, and we've got to get it back we've got to increase it if we really want to go back to doing what they were doing prior to the injury.
No doubt, no doubt. And not all things can be treated conservatively. And I think that's when there is a role for surgery. I think most of us are going to treat things conservatively initially, but we know that there's certain conditions that just, the natural history is that they're not going to do well without surgical intervention. Obviously, if somebody has cut a tendon, that's probably not going to heal by itself without surgical reconstruction. Certainly, if you've torn a ligament, very common anterior cruciate ligaments these days, a lot of those do not respond to conservative treatment and will need surgical intervention. There are certain congenital deformities, club feet. A lot of times we will treat these conservatively with casting, but some are a little recalcitrant to treatment and do require surgical treatment to basically normalize a child's foot and his subsequent life. Scoliosis, we treat a lot of scoliosis, which is a spinal deformity, with physical therapy or bracing, but there are times when this will progress, and we know that if it does progress, it can lead to significant problems in adulthood. And in these situations, surgical intervention can be very helpful.
Tell us also about treatment for children with chronic illnesses, such as cerebral palsy.
Cerebral palsy is kind of an all-encompassing diagnosis, okay? Cerebral refers to kind of the cerebral cortex, which is part of the brain, and palsy means like a injury or something that's affected that. So there are many types of kind of brain injuries. Probably the most common cause for cerebral palsy these days is prematurity or some type of anoxic insult during that early period. And then obviously sometimes trauma can affect the developing brain. So when a child has a type of cerebral palsy, and there's many, many different types, what usually happens is it affects their um, muscle function. It can also affect them cognitively. But from an orthopedic standpoint, I think it's this muscle function that we most become concerned with because certain muscles are working uh, too much and others are not working enough. And it's this muscle imbalance that can cause joint problems, it can cause subsequent muscle problems, and it can cause significant bony problems. And our goal in taking care of these kids is to try to minimize these subsequent problems. And it's a multidisciplinary approach. It's not just a pediatric orthopedic approach. It involves the physical therapist working on range of motion and kind of trying to maintain their developmental milestones. Very often you need an orthotist to help with splinting and braces. A physiatrist is very important. We use modalities such as Botox to try to decrease tight muscles. And then obviously we get involved if, surgical intervention is necessary to prevent subsequent deformities of muscles or joints.
So the important thing that the audience needs to understand is it's a it's a team of people who are helping to that a child with a chronic illness such as cerebral palsy need.
No doubt, and that's why I just emphasize that I'm just a cog in that wheel, okay, and it's a multidisciplinary approach and a team approach.
So following any surgical procedure, do patients typically need post-operative rehabilitation care, and what would you suggest they do?
Well, like we had mentioned before, after any injury or any post-operative period, there's a time where they need to kind of rest and immobilize the joint or bone. But then we also have to get them going again. And with any period of immobilization, there's muscles that aren't being used. They can, get a little weaker and atrophy. Joints can get a little stiffer. And it's imperative that we get physical therapy involved with this to maximize the range of motion of the joints and to maximize muscle strength, because those are our goals before we let kids go back to sports and normal activities. And whether they've had an injury or whether it's a post-operative situation, therapy is really important.
And it can be both inpatient or outpatient, correct?
It can be. I think that it depends on the nature of the injury and the patient and how much therapy you think they're going to need.
And you will have one that you use a lot?
Well, we're very fortunate that we are involved with Children's Specialized Hospital here because they have many, many modalities to help take care of our children, not only from a physical standpoint, but also from, other aspects. And they also help take care of children with chronic diseases, not only cerebral palsy, but like diabetes, obesity. And these are all really very important these days.
Well, as you know, the Bristol Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital, New Brunswick, was recently ranked as the 34th best in the nation for pediatric orthopedics by the U.S. News and World Report. So that just explains how much what they do and what you do as part of them for the children.
Well, it has been a wonderful honor. I think my senior partner, Dr. Skip Loffer, who is now retired, had a vision years ago about developing a children's hospital in New Brunswick. And that has come to fruition. And I've had the pleasure of trying to develop our pediatric orthopedic program. And it's been a wonderful honor to be recognized by U.S. News and World Report. But this isn't about me. This is about our group. And I am incredibly lucky to work with some very, you know, very accomplished, very talented, pediatric orthopedists. Um, Dave Weissman is one of our trauma specialists. Heather Harnley is our sports and arthroscopy expert. Tom McPartland has pioneered a hip preservation program. Steve Adelson is probably a master of every orthopedic operation. We've recently added Dr. Deidre Balicka, who is our upper extremity maven, and she has really developed a wonderful program for upper extremity deformities. Alex Lopian has recently joined us from Michigan. So we have covered almost all of the bases of pediatric orthopedics, and this has enabled us to be recognized. But we also realize that, we're happy about this recognition, but we also understand that this is just a, initial step. There's a lot of things that we still need to do and we want to do better.
So, in addition, don't they also participate in some type of clinical research also?
We have a lot of clinical research going on. We have a number of national platforms looking at clinical outcomes in scoliosis and in hip preservation. We actually have an ongoing level 1 study looking at which medications affect blood loss in scoliosis surgery. We're also trying to look at how we can minimize the hospital stays. We're also looking at, how we can make post-operative pain, less of an issue. Certainly with narcotic overdose these days, that's become something that's a real buzzword, and we are using far less narcotics than we did 10 years ago, and we are studying that as well. But I think that's really important.
And in addition to your involvement in the clinical research, you also serve on the faculty at Robert Wood Johnson Medical School teaching pediatric orthopedics to residents and medical students. Can you tell us a little bit about that?
Well, I've been doing this for a long time, and I think that most of us over the course of our lives have had certain mentors, people who have changed our lives and pushed us in certain directions. And although I love taking care of patients and I love surgery, I think one of the most rewarding things has been taking care of medical students and residents. It's great to see a young resident starting out where they're, a little shy and a little scared of kind of, sometimes their own shadow. But over the course of 5 years, you see how they develop into a caring, compassionate, very accomplished surgeon, and that is incredibly rewarding. It's also really nice to have people that you've trained call you for advice over the years. And it's nice just to keep in touch with these people. So I think that's been a very rewarding part of what I've done over many years.
Well, it's also teaching actually is a terrific thing to be able to do, to be able to give to the next generation all of the education experience that you have, because they're just starting off and you've got so many years worth of experience that they don't understand until they start talking to you, listening to you, watching you, to know that sometimes just a feeling that you have makes a difference.
Nicely said.
So before we conclude today's show, what are key messages that you want to leave the audience about pediatric orthopedic services at RWJBarnabas Health?
Well, I would tell you that we have developed a wonderful pediatric orthopedic program, and that we can take care of every pediatric orthopedic problem. Not only take care of them, but we can take care of them with expertise. I would also say that our physicians here are not only technically capable of doing all of these things, but they are caring, compassionate physicians. And a large part of helping somebody recover is helping them physically, but also on other levels as well. And being a caring, compassionate physician is vitally important in their well-being and in their subsequent recovery. And I think I've been very fortunate to be able to work in one facility for my entire career. And right now we have a beautiful new complex on Route 18 where our entire orthopedic program is based. We have the state-of-the-art x-ray with the EOS. We have physical therapy. We have our orthotist here, and we will be also incorporating other surgical pediatric specialties. So I think that we have developed a wonderful program, but we still have more work to go.
And it's in the community also. So from a child seeing their pediatrician, going to this close facility, having all this experience from the full team and the post-recovery, doing it all in their own home backyard makes a big difference also.
Oh, there's no doubt. And I think that we can take care of everything, in this area. I think people do not have to travel for expertise in these areas.
Well, thank you for being on this show, and congratulations to you and the whole Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital, New Brunswick, for all the tremendous work that you do for the community.
Well, thank you very much. It's been very, very rewarding, and thank you for this opportunity.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about pediatric orthopedic services at RWJBarnabas Health, please visit www.rwjbh.org/children's health.